Okay, so you've shared this information about whiplash injury treatment, and we're going to really dig into it now.
Sounds good.
Our mission here isn't just, reading it back. We want to pull out the key stuff about whiplash and specifically how chiropractic care fits in based on this source you gave us.
Right. And the source is Advanced Healthcare of Spartanburg.
Exactly, yeah. A clinic that actually specializes in whiplash injuries down there.
Okay.
And they lay out the main symptoms pretty clearly. Neck pain, headaches, dizziness, even nausea, and blurred vision sometimes.
Quite a range.
Yeah. So let's explore how chiropractic, according to them, tackles these problems.
All right. So first things first, what exactly is whiplash based on what they say?
Good starting point.
They describe it as, well, a neck injury happens because the head gets suddenly jerked, like snapped forward or backward.
Right, that sudden movement.
Yeah, really forceful. They mention car accidents are common causes, which makes sense. But also sports injuries or really any situation where your head moves really fast and hard. It's kind of fascinating how that one jolt can trigger so much,
Totally.
Yeah.
And that's where chiropractic care comes into the conversation. According to this clinic,
Okay.
their info presents it as a treatment focused on the alignment, specifically the spine and the nervous system.
Right.
So how does that idea connect to an injury like whiplash?
Well, think about the mechanics of it. That sudden impact, that jolt we talked about, it can definitely knock the vertebrae in your neck out of their normal position.
Okay, misalignment.
Exactly. And that shift can then mess with the muscles, the ligaments around the spine, and potentially even the nerves that run through there.
I see.
So chiropractic care, in this view, is aiming to correct those specific misalignments, get things functioning properly again.
And Advantage Healthcare, they list out quite a few potential upsides to this. Number one is pretty obvious. Relief from pain and discomfort.
Which is, usually the main reason someone seeks help for whiplash, right?
Absolutely.
And they actually package this as the chiropractic advantage. Would you break that down?
Yeah, let's look at those points. So first up, they say chiropractors have specific expertise in treating whiplash.
Okay, so suggesting a deep understanding of this particular injury, not just general back pain, but whiplash specifically.
Right, and experience using chiropractic techniques for it.
Makes sense.
Then they mention something interesting. Potentially preventing future injuries. How would that work? Better alignment means more resilience.
That seems to be the idea. If your spine and all the muscles and ligaments supporting it are working like they should, optimally, then yeah, maybe they are better able to handle everyday stresses or minor bumps. Could potentially lower the risk of hurting that same area again. It's a logical thought process.
Okay. The clinic also points to chiropractic treatment, helping reduce inflammation and promoting the body's own healing process.
Yeah, inflammation. It's the body's natural alarm system after an injury, right? Kicks off the repair. But if it sticks around too long, becomes chronic, it can actually slow down healing and keep the pain going.
Right.
So the idea here is that by tackling the underlying structural issues, the misalignments, chiropractic might help calm down that excessive inflammation, support the body's natural recovery.
They also frame it as natural, safe, and effective pain management. And they stress it's part of a bigger picture, a comprehensive rehab program.
Those are definitely keywords people look for. Natural and safe appeal to those wanting to avoid drugs or surgery.
Sure.
And emphasizing comprehensive suggests it's not just about the adjustment. It works best potentially alongside other therapies, exercises, lifestyle changes.
Right, the whole package.
Exactly.
And the last point on their advantage list is that it can contribute to overall health improvement. That sounds broad, beyond just the neck.
It does, doesn't it? It hints at that interconnectedness of the body. I mean, the spine is central to posture, movement, even nervous system function.
Sure.
So maybe fixing problems in the spine could have ripple effects, positive ones, on your general well-being. It's an interesting claim.
The clinic material also really emphasizes getting an accurate diagnosis and creating a tailored treatment plan, not one size fits all.
Which is crucial for any medical treatment, really.
Yeah. And they talk a lot about patient education, teaching people about, vertebral subluxations and just general spine and joint care.
Vertebral subluxation, that's a core concept in chiropractic.
Okay, what does that mean in this context?
Well, from the chiropractic viewpoint, it's generally described as a misalignment or maybe a dysfunction of a vertebra that impacts the nervous system.
Ah.
So explaining that to patients helps them understand why certain treatments are being done and why spinal health matters, according to this perspective.
They specifically mentioned their chiropractor, Dr. Vinayam Korakov, as being key in assessing how bad the injury is and helping get movement back.
Right, the assessment part is vital, understanding the extent of the damage before starting treatment. And restoring mobility is often a huge goal after whiplash locks things up.
And they don't just rely on adjustments. They also recommend specific exercises and stretches, strengthening spinal muscles,
Yeah, active care.
and giving advice on preventing more problems and managing pain ongoing.
Hmm.
Seems like it empowers you, the patient, a bit.
Totally. That's often part of a good recovery plan, isn't it? Giving you tools you can use yourself. Those exercises and stretches are vital for supporting the healing, rebuilding strength, getting flexibility back, and hopefully stopping it from happening again.
Now, this next point sounds pretty positive. The source says most people get pain relief from chiropractic treatment for whiplash, and often it's long-lasting relief.
That is encouraging to read. Of course, individual results always vary.
Sure.
But reporting general success in pain reduction definitely highlights the potential. And long-lasting suggests they're aiming to fix the root cause, not just temporary relief.
They also note that chiropractic care can improve range of motion and flexibility in the spine and back.
Well, that makes intuitive sense. If you're correcting alignment and reducing stiffness or restrictions in the spine,
Yeah,
then you'd naturally expect movement to become easier, more fluid, which is often a major issue after whiplash, that stiffness.
definitely. It's also interesting they briefly mentioned lifestyle changes having long-term positive effects on the spine, and maybe even helping with stress and muscle tone, though that's more in the context of general spine care, not just whiplash.
It reinforces that bigger picture, right?
Right.
Our daily habits, exercise, posture, how we manage stress, maybe even diet, they all feed into our spinal health over time.
Yeah, it's all
It
connected.
helps prevent future problems too, potentially.
The clinic also makes a point of saying, and I'm quoting roughly here, chiropractic is a lot more than a chiropractor popping your back.
Addressing the stereotype.
Yeah. Why do you think they felt the need to state that so directly?
Well, that image, the quick crack or pop, is probably the most common perception of chiropractic, but it's incomplete.
Right.
By saying that, they're likely trying to signal that there's more to it. It involves understanding biomechanics, the nervous system, rehab strategies, a more holistic approach maybe, aimed at the root causes.
Gotcha. Shifting gears slightly, they do touch on practical stuff too, like insurance and costs. They basically say, contact us for details.
Which is important. Healthcare costs and coverage are always a major factor for people making treatment decisions. Practical reality.
Yeah, definitely need to know that. And finally, they provide a suggested reading list. It's pretty varied.
Oh, what's on it?
Well, books on chiropractic principles, sure, but also stuff on the mind-body connection to pain, like Sarno's work, and then broader books on natural healing, Mercola, James Chestnut, a mix.
Interesting. That diversity suggests they might be open to, or at least want patients to be aware of, different viewpoints on health and healing.
Yeah, like encouraging you to explore beyond just their specific approach.
Yeah, could be. Shows a broader perspective on back and neck health.
And lastly, just for awareness, they list all their contact info. Advantage Healthcare of Spartanburg, the full address on John B. Weitzer's Levy D, phone number, ours. All there if you're in that area and interested.
Makes sense. Making it easy for people to follow up if they want to.
Okay, so let's try to wrap this up. We look at this info from Advantage Healthcare. Whiplash, they say, is that neck injury from a sudden head movement. Symptoms like neck pain, headaches.
Right.
And their chiropractic approach focuses on spinal alignment and the nervous system.
Yep.
Aiming to potentially relieve pain, cut down inflammation, improve movement, maybe even prevent future issues.
And they stressed a comprehensive approach, diagnosis, treatment education, exercises, advice.
Exactly. So based on this source, that's the picture he'll paint of chiropractic for whiplash.
It definitely lays out one specific perspective and treatment philosophy clearly.
And it really underlines, again, if you think you have whiplash, getting professional help is key. This information from Advantage Healthcare offers one avenue to think about.
Absolutely.
It certainly makes you consider how closely linked our spine is to just feeling well overall, doesn't it?
It really does, that central pillar.
And with that reading list they provided, it suggests there are a lot of different ways to think about and understand back and neck health. even beyond what we discussed today, something to potentially explore further.